Hello and welcome. Today we're diving into a complex and often misunderstood topic, Narcissistic Personality Disorder or NPD. This disorder affects how individuals perceive themselves and relate to others, often leaving a trail of emotional distress in relationships. Let's explore what defines NPD, how it presents, and what impact it has on those close to someone with this disorder. Narcissistic Personality Disorder is classified in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, often referred to as the DSM-5. This manual serves as the primary authority for psychiatric diagnoses. Within the DSM-5, it is categorized as a Cluster B personality disorder, a group that also includes antisocial, borderline, and histrionic personality disorders. These disorders are often characterized by dramatic, emotional, or erratic behaviors. Narcissistic personality disorder, in particular, centers around a distorted sense of self and relationships with others. It is characterized by a pervasive pattern of grandiosity, a constant and overwhelming need for admiration from others, and a significant lack of empathy towards those around them. This pattern typically begins in early adulthood and is consistently present across a wide range of contexts and situations. The DSM-5 outlines 9 specific criteria that are used to determine a diagnosis of narcissistic personality disorder. To meet the diagnostic standards, a person must exhibit at least 5 of these criteria consistently over time. Some of these criteria include an exaggerated and often unrealistic sense of self-importance, a belief in one's own superiority, and a tendency to overestimate one's accomplishments and talents. They also experience persistent fantasies of unlimited success, power, brilliance, ideal love, or recognition. Further diagnostic points include a strong belief that they are special and unique and can only be understood by or should associate with other special or high-status people or institutions. They also demonstrate a need for excessive admiration and attention from others, and a sense of entitlement, expecting favorable treatment and automatic compliance with their expectations. Other criteria involve exploitativeness in interpersonal relationships, taking advantage of others to achieve their own ends, a lack of empathy, and unwillingness to recognize or identify with the feelings and needs of others. They also display envy of others, or a belief that others are envious of them, and arrogant or haughty behaviors or attitudes. It's important to distinguish between healthy narcissism, which involves a normal and adaptive level of self-confidence and self-esteem, and pathological narcissism. Pathological narcissism is where this self-focus becomes rigid, chronic, significantly impairing their ability to function in relationships, work, and other areas of life. Dr. Otto Kernberg, a key figure in the field of psychodynamic psychology and personality disorders, described narcissism as existing on a spectrum of severity. He differentiated between normal narcissism, neurotic narcissism, and malignant narcissism, with the latter representing the most severe and particularly destructive form of the disorder. In real-life settings, narcissistic traits may present in subtle and sometimes not so subtle ways. It's important to remember that these are patterns of behavior, not isolated incidents. Recognizing these patterns is the first step in understanding the impact of narcissistic personality disorder, or NPD, on relationships and interactions. Individuals with NPD may initially appear incredibly charming, confident, and ambitious, especially early in relationships or new social circles. They often possess a magnetic quality that draws people in. This behavior is often referred to as love bombing, lavishing excessive attention, praise, and gifts to quickly idealize a new partner or potential friend. It's a whirlwind of affection designed to create a strong bond rapidly. However, as relationships progress beyond the initial infatuation stage, a darker, more challenging side may gradually emerge, revealing the underlying fragility. These individuals may exhibit a range of difficult behaviors. They might react with intense rage, defensiveness, or cold detachment when faced with even the slightest criticism or perceived slight. They may also consistently blame others for their own personal failures, deflecting responsibility and avoiding accountability for their actions and mistakes. Furthermore, they might monopolize conversations, constantly steering the focus back to themselves, or dismiss the feelings and experiences of others as unimportant or invalid. Individuals with NPD might also employ gaslighting tactics, a form of psychological manipulation used to control or distort another person's reality and make them question their own sanity. Clinical psychologist Dr. Ramani Durvasula emphasizes that the true hallmark of narcissism isn't genuine confidence, but underlying fragility, a profound and often hidden sensitivity to perceived slights or criticism, which is often masked by an outward display of arrogance and superiority. Research conducted by Campbell and Foster in 2002 also indicates that individuals with narcissistic traits tend to significantly overestimate their own attractiveness and social competence, while their partners consistently report lower levels of relationship satisfaction over time, highlighting the detrimental impact of these behaviors on interpersonal connections. Narcissistic individuals often struggle with emotional intimacy. Their lack of empathy and exploitativeness can deeply affect those close to them. Common effects on partners and family members include chronic self-doubt and low self-esteem, emotional exhaustion, feeling invalidated or invisible, anxiety and depression. A term that frequently arises in this context is narcissistic abuse. This refers to psychological manipulation, including gaslighting, silent treatments, and blame shifting. Psychologist Eleanor Greenberg, an expert in schema therapy, notes that people with NPD may use defensive mechanisms like splitting, seeing others as all good or all bad, as a way to protect themselves from shame or vulnerability. Children of narcissistic parents often develop what's called scapegoat or golden child roles, impacting their sense of identity into adulthood. Despite its challenges, NPD is treatable, especially when the individual is motivated to seek help and willing to engage in the therapeutic process. It's important to remember that change is possible, and many individuals with NPD can lead fulfilling lives with the right support and interventions. Treatments may include psychodynamic therapy, which explores the underlying psychological roots of the disorder. Schema therapy, which addresses deeply ingrained patterns of thinking and behavior, can also be beneficial. Additionally, dialectical behavior therapy, DBT, originally developed for borderline personality disorder, can help individuals with NPD manage their emotions and improve their interpersonal skills. However, treatment resistance is common due to the egocentric nature of the disorder, meaning the person does not see their behavior as problematic or in need of change. This lack of insight can make it difficult for individuals with NPD to recognize the impact of their actions on others and to fully commit to therapy. Overcoming this resistance is often the first and most significant hurdle in the treatment process. Still, with time and consistent work, individuals with narcissistic traits can develop greater self-awareness, learn to regulate their emotions, and cultivate empathy towards others. This journey requires dedication, patience, and a willingness to confront deeply held beliefs and behaviors. For those affected by someone with NPD, setting firm boundaries is crucial for protecting their own well-being. Seeking therapy or joining support groups can provide a safe space to process their experiences and develop coping strategies. Rebuilding self-worth, which may have been eroded by the relationship, is an essential step toward healing and reclaiming their lives. Thank you for joining this exploration of narcissistic personality disorder. We hope this video has provided valuable insights and a deeper understanding of this complex condition. Understanding the condition is the first step in navigating its challenges. Whether you're a clinician working with patients, a loved one trying to support someone with NPD, or simply someone seeking clarity and information. If you found this helpful, please consider sharing it with others who might benefit from this information. Knowledge truly is power, and by spreading awareness, we can help reduce stigma and promote understanding. If you found this video helpful, please subscribe to our channel, Mind Motives, for more insightful content on psychology, relationships, and mental health. Until next time, take care of yourself and take care of your mind.